Enloe Health is phasing out its home health and hospice services, and it will impact dozens of employees.
Action News Now reporter Margot Rowe is live at Enloe Health in Chico. Margot, what led to this decision?
Alan, I spoke with the CEO of Enloe, Mike Wiltermuth, and he explained to me that it all came down to finances, and that since COVID, the health organization hasn't been able to support that department financially.
And obviously, this is going to be very disruptive to a lot of folks. So we're going to work hard collaboratively with them to try and give them a place to land and make sure that they're taken care of to the extent that we can.
On Wednesday, Enloe Health announced the slow closure of its hospice and home health services. In its place, a new partnership with Butte Home Health and Hospice will be fully integrated by this fall.
So we are really excited about entering into a preferred provider agreement with Butte Home Health and Hospice. This is going to enable us to work collaboratively with them. They've got a much larger organization. They do a great job. They're a 5-star Medicare rated facility.
The transition will impact 75 employees when it comes to their jobs, but Enloe Health is working to try to relocate them to different departments as the transition period continues.
Now, our organization typically, through natural attrition, retirements, and people moving on, we have to replace about 60 employees per month. So there's going to be about 180 positions that open up during this 90-day transition period. Now, not all of those positions, of course, these are home health and hospice employees will be eligible for, but we hope that there'll be enough that the vast majority can either find a spot there or find a spot potentially with Butte Home Health and Hospice.
Wiltermuth says Butte Home Health and Hospice will be expanding due to the transition, but he also acknowledges that these efforts don't mean a guaranteed job for everyone impacted. He says there are severance options, but the health organization is hoping to help everyone with a soft landing. With more federal cuts expected, moving forward, Enloe Health wants people to be aware that even more changes could come, depending on where things stand financially.
I don't think we're in a position where we have to panic, but we do have to act responsibly, and we have to look down the road and see what kind of impacts that those are going to have. So our job is to make sure that we can maintain our financial viability, and if there's an opportunity to work with a community partner or a joint venture with somebody where we can combine our resources, we may be doing those kinds of things going forward.
And nurses are expected to be among those laid off. So I reached out to the California Nurses Association to hear about their thoughts on the matter and received this statement back, where the CNA believes that this change will impact patients negatively when it comes to disruptions in patient care and services, and that nurses will continue to advocate for their patients to ensure that their care isn't disrupted or reduced. And we have that full statement on Action News Now under this story. Reporting live in Chico, I'm Margot Rowe for Action News Now.
Thank you, Margot. The partnership will fully take effect October 31st of this year. The executive director of Butte Home Health and Hospice also weighed in this and is adamant that the new partnership will be better for the community.